Hello, and thank you for joining us for today's virtual education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Reclaiming Intimacy, Relationships and Cancer, Intimacy, Body Image, and Sexual Dysfunction. Before we begin, if this is your first time joining us, CSC South Bay's mission is to ensure that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by communities so that no one faces cancer alone. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Without further ado, I'd like to introduce our workshop speaker. Jen is the Director of Educational Services for Reclaiming Intimacy in Fort Wayne, Indiana, in the United States. She has worked in the education field for over 16 years, with most of that time focusing on adult sexual education and intimacy issues, holding a bachelor's degree in both education and business entrepreneurship. Thank you, Jen, so much for being here with us today.
You are very welcome, and thank you for having us to talk about these very personal, very private, and very taboo topics. As we get started tonight, we will be discussing body image, intimacy and intimacy issues, and of course, sexual dysfunction. We're going to cover the most common types of sexual dysfunction for both men and women, and then talk about some of the holistic options that exist that you can kind of work on your body and get yourself back on the path to intimacy and to kind of seek out your desires and goals. We're going to kind of just explain who we are and what we do at Reclaiming Intimacy just for a couple minutes, and then we'll get to the good stuff. So what we do and who we are an advocacy organization, and we focus solely on intimacy issues, sexual health, sexual wellness, and sexual dysfunction. We work the most with cancer patients from the time of diagnosis all the way into survivorship. And then we work with anyone who's really facing sexual dysfunction issues, whether it be from aging, from things like menopause and natural life changes, hormone fluctuations, long-term illnesses. The list just kind of goes on and on. The truth is that most all humans will experience some form of sexual dysfunction in our lifetime. And whether that be occasional, partial, or a full loss, just kind of depends on the situation. So we have conversations just like the ones that we're going to have tonight with medical organizations, with hospital organizations, with doctors, oncologists, gynecologists, urologists. And we kind of stand in the middle between patients and medical professionals. And we kind of direct patients and help them find doctors and specialists that they might need, therapists even for mental health issues. And then we help medical professionals get the correct information about sexual dysfunction and intimacy issues to patients through hospital systems, through brochures, through digital information, and things like that. So our main goal at Reclaiming Intimacy is to empower people with education, because we feel that once we fully understand what our bodies can do in the situations that we're in, we can be empowered to make the right choices and feel confident in those decisions and with our bodies. And like I said, our staff is all experts. We have product specialists, we have device specialists, we have education experts and specialists, experts on staff. And we are just here for people as long as they need us. We can help people learn how to use specific devices. We can walk them through that. We make guides for people, which is this slide here, personal intimacy and wellness guides. And all the things that we do, all the services that we have are all free for the people that we work with. The only thing that costs anything on our website are for the specific devices. And some of those are actually covered by insurance, which we also help with. So if you are ever interested in one of our personal intimacy and wellness guides, the sign up is over on our website. It's super simple. We learn your situation, what your goals are, the things that you've kind of lost in the intimacy and sexual department. And we kind of help you get back to that working in a holistic way. No medications, no chemicals, no surgeries, no extra prescriptions, just some super simple things and therapies that you can do with your own body. We also have lots of education on our website. There's tons of articles. Covers just about every type of cancer, every type of long-term illness, and how it relates to intimacy, sexual function, and dysfunction. And we also have a platform now on our website that has lots of free videos, which are actually interviews with medical professionals discussing lots of different topics in relation to sexual issues and dysfunction. We've got some with colorectal cancer issues in relation to dysfunction, pelvic floor for female and male, really just all sorts of things. And that's there 24 hours a day, should you ever need that information. And then, of course, we've got lots of devices on our website and on our parent website as well. And the devices that we have are medical grade devices. So these aren't like your standard sex toys that you would see in some adult shops. These have a more medical base with a medical purpose to help heal different parts of the body. These devices are available for men and for women. And there's lots of different options out there. So that's something that we kind of help with to help people to get the biggest bang for their buck, so to speak, and to make sure that they're getting the right types of products, especially if they're looking for insurance coverage. We will talk about some of those types of devices when we cover the common types of sexual dysfunction here in just a little bit. And this slide presentation will also be sent back over to Rebecca so that she can share it out. Should you need to kind of re-go through things to look at this information, you can have it at your fingertips as well. And just some of the things that we cover with devices is the male self-discovery, different types of muscle massage, erectile dysfunction support, vaginal atrophy support, pelvic floor wellness and support. And then, of course, we've got lots of other things with lubrications and different daily moisturizers that are all natural as well. Another thing that we do is we have an open house monthly where people can just drop in and ask their questions privately or publicly in the groups. People stop in to get tips on how to use specific devices that they've gotten, or if they're struggling with different things. We get lots of questions about penis pumps in these meetings. And it's just an easy way for you to drop in quickly to get those questions asked and answered. The contact information is also in the slide presentation should anyone need it. Does anyone have any questions so far about the basis of reclaiming intimacy? I'm going to assume not, and I'm going to keep moving. But feel free to stop me if you do. So part one, we're going to discuss intimacy and body image. We always start our presentations by defining intimacy. And you'll see in some of our slides that there's going to be big questions in bold. These questions, we always say that you don't necessarily need to answer them for the group unless you really wanted to. But these are more for you to kind of take back with you for your personal time. Write them down in a journal for you to think about and answer for yourself or with your partner at a later time. And these types of questions can help you kind of jumpstart that conversation about intimacy and sexuality and desires and needs, and kind of help you to bring it back into your life and to your relationship. So we always start with that question. What do you first think of when you hear the word intimacy? And so often when we ask this question, everybody just kind of yells sex. Because for so many people in our world, especially, when any discussion of intimacy comes up, people's minds immediately go to sex. And that's just not at all true. Of course, sex can be a type of intimacy, physical intimacy, but it is nowhere near the only type of intimacy. The dictionaries define intimacy as the state of being intimate, very warm and friendly, something of a personal or private nature, or our innermost thoughts and feelings, affecting one's innermost self, closely personal. So intimacy is our deepest selves, the parts that we don't just share with anyone until we have a comfortable bond and we feel supported and safe. And of course, intimacy is different for everyone. It's defined differently for everyone. Everyone needs different types of intimacy. And the importance of intimacy in a relationship. Intimacy, like I just said, allows us to bond and connect with each other in various types of relationships, not just a marriage or a partnership, but also in our friendships and our familial connections, even with our coworkers, and even our next door neighbors. All those relationships have different types of intimacy within them. The word intimacy is derived from the Latin word intimus, which again means inner or innermost. Of course, we always talk about physical intimacy and sex and all of the physical acts of sex, but there's lots of other types of intimacy. And on this slide, these are the 5 most common types of intimacy that are discussed most often and openly in our world and our daily lives. So, of course, physical intimacy is at the top, and it's vital in relationships, especially in a partnership or marriage, but it is not just sexual intercourse. Um, Physical intimacy can be the simplest of gestures, shoulder, holding hands, any type of skin to skin touching if you're sitting next to each other watching TV on the couch. That counts as physical intimacy. It can happen in so many small, gentle ways where all of the clothing is left on. Emotional intimacy is also a vital type of intimacy needed within all relationships. And these are built into relationships when both parties of the relationship take the time to really focus on the other person, listen to the other person, and be present and supportive of the other person. That could be doing nice things, leaving notes, paying attention when big events happen, being supportive during stressful events, helping to carry that emotional load. Intellectual intimacy is exercising your brains together, essentially, discussing important topics in the world, discussing silly things that you find on the internet together, anything that kind of gets your brains working together and brings you closer in that conversation. Experiential intimacy is shared experiences, doing things that you like together and creating memories and future discussions and things to look back on, getting those experiences together. And then spiritual intimacy. And it's not just religious ideas or just church style ideas, but this is also morals and values and your core beliefs. And sharing these together also helps strengthen that bond. But again, those are the 5 most common types of intimacy that you hear about. But there's also over a dozen other types, like chaos intimacy, crisis intimacy, creative intimacy, work intimacy, like that intimacy you have with your coworkers, aesthetic intimacy, how you like your environment and how things look. The list just kind of goes on. And all of these types play into our relationships every day. With body image and cancer. So body image is how we feel and see ourselves and our bodies, and how we think about ourselves and how our bodies look to us. And this affects our daily interactions, our daily lives, mentally, physically. It affects our confidence. And it can also impact how we interact and relate to others. And this is true for everyone, male, female, everyone. And there's also an emotional toll that comes in when body image kind of becomes a problem. And those are most often kind of the negative mental health issues like depression, anxiety, feelings of isolation, losing those intimate connections, not even sexual connections, just all of the intimacy. And then just kind of developing kind of a dull love for life. It's just not as exciting as it once was. And a lot of the people that we work with have described this as being like they've lost confidence in their bodies, that they feel like their bodies have let them down, or that their body is just not good enough or up to par with someone else's body. And so body image is a part of our self-image. How we feel about ourselves. It overflows into everything that we do. It's not just our physical appearance, but it's also how we're thinking about ourselves, our perceptions of how other people see us and how we see ourselves, and the feelings that we have about our body and the changes that it's been through. And anything that can alter your feelings about yourself, whether it be physical or mental or emotional, that's affecting your body image. And there's a quote at the bottom of this slide that we added in here. And we added it because we hear from so many people that they feel like they're so alone with the way that they feel about themselves and the negative things that they're thinking after they've gone through cancer treatment, especially with surgical intervention. And so this quote, more than half of all cancer patients struggle with body image at some point in their cancer journey. We threw that in there because our hope is to let people know that they're not alone and that very many people are facing these same types of issues as they battle against cancer and other long-term illnesses. And these lists, you'll see a few lists through this as we go. And the lists that we have made in our presentations are from patients and people that we have worked with since 2013 when we started this, and the things that we hear from them. So of course, many of these lists could go on and on and on, but these are just the things that we hear the most. So body image issues that affect self-view, the changes, the alterations, the missing or altered body parts that happen during treatment for cancer. These can all affect our positive mental headspace. They can kind of turn it to a more negative side. The loss of self, this is something big that we work with people on. We have a lot of educational courses that can help people work on themselves to kind of reconnect with themselves so they can connect with other people again. And that happens due to the changes of routine, kind of the change of life, essentially. Losing the goals, you feel like you can't plan for the future quite as much, and losing your body identity. And then, of course, relationship disconnect. This is also a very, very big one we deal with a lot. Relationship disconnect can happen for really any reason through life. Anything that's stressful or chaotic can kind of cause a divide that can be hard to get back from. Hiding truths, not communicating as much as you should, having a disconnect from your partner. And that can happen also because you're disconnected from yourself. And sometimes there can be no real easy path to kind of get things back on track. So reaching out to a place that can help, or a therapist or a counselor, is sometimes your best bet. Working through the most common physical and body image changes. And this is just another list like I just mentioned. So we hear from men and women alike that these things are very difficult to work through when it comes to body image. So the scars, the loss of hair, loss of muscle tone, frailty, loss of sexual ability, skin issues, which could be rashes, pain, any type of different skin issue, changes in body shape and size, weight loss or weight gain, loss of organs or body parts, loss of fertility, ostomies, feeding tubes, hormonal changes, and body pain. Some of these are temporary and some of these could be permanent. For males, we hear the changes in their penis size and girth, and then erectile dysfunction are often very difficult to kind of get that body image and physical function back on track. And for females, the loss of breasts, vaginal pain and atrophy, and early menopause, along with loss of fertility, can really impact body image and make it very difficult to continue moving forward. And then there's a question at the bottom of the slide for journaling or to think about later. What physical issues or changes most affected your life and body image? And then we've got a couple of tips for people to kind of help to work on improving body image. And of course, all these tips, they're easy to say out loud and they're easy to talk about, but of course, sometimes it is hard and it does take time to really work on yourself, to reconnect with yourself, and to really face the body image issues that you might be having. And however long it takes, it's okay. There's no set time frame. Everyone is different, but it's just important that you give yourself time, you give yourself the love and space that you need to really connect with yourself again so that you can keep going in life. And so the first tip, be aware of your internal self-talk. So your internal self-talk, the thoughts that you have about yourself. And a lot of people say that to get around negative self-talk, you need to make time to talk to yourself directly with positive talk or positive affirmations, like in your bathroom mirror in the morning, or even at night before bed. Just positive statements about yourself to yourself while looking at yourself to support yourself. And doing this daily can help to change your headspace. Understanding your own communication needs. Everybody communicates in a different way. Some people do better with listening. Some people do better with writing. Some people do better with reading or acting or doing. And knowing how you communicate the best can help you to better connect with your partner, with your family, with your friends. And so taking the time to make sure you're communicating is very important. Trying positive new sensory experiences, like mindfulness exercises, or different types of exercises that can make you feel euphoric or feel happy, something that takes you to a happier time, whether that be listening to your favorite songs, taking a bath, going and getting a massage, relaxing with candles, even meditating or doing yoga. There's lots of apps out there now that can help you with meditation if you've never done it before, because it can be kind of tricky to get started, to learn how to kind of quiet your mind and get into that meditative state. One of my favorites is Headspace. And it's just a great app to kind of get you started and let you try meditation and see if it's for you. The next is to take care of your body. Many cancer agencies say that patients and people should be active for at least 150 minutes of exercise a week. And so we always like to remind people that if you haven't been very active, to always check in with your doctor, especially if you're dealing with cancer, just to make sure that you're okay to do these workouts, and that your body can handle the stress that you might be putting it under. Next is seek support. And of course, it's helpful to reach out to others who might be going through similar situations in like a support group, much like this one tonight, and to share your story, share your circumstance when you're comfortable. Of course, that is up to you when you share and how much you share with others. But this can help you to stave off depression and anxiety, be open to listening to others and talking about it, which can overall help with your support. And just a few more tips. Change your style. A lot of people that we have worked with over the years after their diagnosis and their treatment, they do something kind of random. One lady I worked with last week, she got a crazy haircut and color after she got to ding the cancer bell after her treatments had ended, and she was so very excited about that. Some other people change their whole look, buy some new outfits, try to spice things up. So really just doing something for yourself to make yourself feel good. Staying active. And this one's not quite just exercising. This one just reminds you to get up and move around, even if it's just in your own house. So often when we're in recovery or we're going through heavy medical things with all the medications and prescriptions, we can't always get out and exercise, but we sure can get up and move around our house. And sometimes that movement is all it takes to keep us going. Face your intimacy issues. We always say, don't ignore these issues. So many people feel like, okay, yes, this is happening and I don't like it, but right now I've got so much other stuff on my plate, I'm just going to put it on the back burner. Well, it gets left on the back burner for too long. And some of these issues, like erectile dysfunction, like vaginal atrophy, these issues can actually get worse if they're not dealt with. So it's always important to bring up these issues as you're having them. It doesn't mean you have to take immediate 100% action when you do, but to let your doctor know that these things are happening, so that they are aware to have these conversations with you as well, because they don't know unless we are telling them. Try intimacy without intercourse, because remember, intimacy is not just sexual intercourse. Try other intimate situations. Cuddle on the couch. Set up a gentle massage area for you and your partner. Take turns giving each other simple back massages. Make dinner together. Do some sort of activity that you both enjoy together. And if you need self-intimacy, that's self-care, take the time with yourself to give yourself the care that you need. And then lastly on this slide, own and hold your boundaries. You are in charge of when you share about your cancer or your illness. You are in charge about when you discuss intimacy issues or sexual related issues. These things have to be agreed upon. If you're in a partnership, you have to kind of come to a consensus at a comfortable time for both parties to discuss these topics so that it's not awkward for anyone. And then also on this slide, you can see a question at the bottom. If you have tips or suggestions for others on how to improve body image, you can put that in the chat for everyone to see, or you can just make a list for yourself later. I've talked a little bit about self-care, and self-care is very important to us here at Reclaiming Intimacy. It is different for everyone, but it is a very necessary part of life if you want to live a whole, level, healthy life. Relearning yourself after medical chaos and life stressors can be very challenging, and it can take a very long time. It might require you to learn new ways of doing things. It might require your routines to change drastically, and including your methods and your routines with intimacy and sexual acts as well. But self-care is when we take the time for ourselves to make sure that we are whole and healthy, so take care of people the way we think we need to. And so for some people, self-care is going on new adventures or taking a trip or traveling. For other people, it's getting their nails done or getting a massage. For me, I always like to say, just check out my background. There's plants and books. If there was a cat in the picture, it would be perfect. That would be everything I need in life. But self-care is important, and it can help you to kind of get to know yourself and your body again while you give yourself the space to heal. And those are all very important things. So there's a question there at the bottom. How do you practice self-care? And then if you think about that question later and you don't have a good answer, that means you need to practice self-care a little bit more. All right. This slide here is the physical and hormonal changes for women. So these are the things this is the list that we've gotten from our female patients of the things that we hear are the biggest struggle that affect intimacy and sexual acts. The first is incontinence, and that can be bladder, bowel, or both. Changes to vaginal lubrication and vaginal tissues. And that occurs most often, if you jump down to the bottom of that slide, to vaginal atrophy. Vaginal atrophy is the thinning of the vaginal skin and basically the whole vulva. The dryness of that area, which can range from kind of mild to very painful and very severe, and the loss of elasticity of the vaginal canal, which means that it's no longer pliable and moves as it should. It's just very hard, tight, and dry. And then also for women, due to chemotherapy, radiation, and surgical interventions, hormone fluctuations with low circulating estrogen, which can lead to loss of fertility, early menopause, and decreased libido, altered anatomy from surgical intervention, and then mucosal alterations, which covers all of our mucus producing tissues in our body, so our mouth, our nose, our organs internally, the rectum, the anal canal, the vagina, all of those places that produce natural moisture tend to just dry up like the desert. And that can be really hard to deal with. And for women, if you're struggling with those things and you're not sure who to talk to, you can talk to your oncologist, you can talk to your MD doctor, you can talk to your gynecologist, or a person like me, a sexual wellness expert. And the list for men is very similar to that of women. Men can also face and struggle with incontinence of the bladder, bowel, or both. Men struggle with normal sexual function. For a man, normal sexual function, which is getting an erection, it involves 4 different body systems working together at the same time. So the vascular system, the neurologic system, hormonal system, and the psychological system. So if any of those systems are off in the slightest bit, a man will struggle to get an erection and then also struggle to maintain that erection. And men will also face surges or a lack of testosterone, like low T. They can have a loss of sensation, penile pain, and then they face declining functions with cancer, conditions, treatment, and sometimes even age, which are erectile dysfunction or ED, which can be an occasional problem, a partial loss, or a complete loss, depending on their situation. And they can also face something called ejaculation dysfunction or abnormal ejaculation, which can be an early ejaculation, delayed ejaculation, or completely absent ejaculation, which is also called a dry orgasm. And for men, If you're struggling with those and aren't sure who to talk to, again, your oncologist, your urology specialist, person like me, or your MD doctor. I'm going to pause right here and check the chat.
If anyone has any questions, feel free to put them into the chat.
Yep, and the question in there now, yes, the slides will be available.
Jeanette, yes, if you can email me, I am putting my email in the chat right now, rebecca@cscsouthbay.org. If you email me, I will email the recording and also the slides once they are available. Thank you, very important question. Any other questions, you can put them into the chat or you can unmute yourself and that'll indicate to me that you have a question to ask.
All right.
There'll be other points as well. Perfect. Thank you so much.
No problem. Part 2, sexual dysfunction. So here we get into some of the good stuff. So sexual dysfunction can occur for a variety of reasons through life. It most often happens because nerves and cells get damaged inside the body, which prevent our body and our muscles and our cells from doing what they are naturally designed to do. So like I mentioned earlier, most all people will face some form of sexual dysfunction in their lifetime, and it is defined as any issue or problem causing struggle to achieve sexual activity or pleasure with the self or with another. And our bottom line we feel here at Reclaiming is that you need to give yourself time and space to heal and practice self-care by being sure to give yourself space on every level of healing. So often we work with people who like to skip steps and not reconnect with themselves, not get to know their own bodies again after all these changes. And inevitably, even if they are able to move forward, they always end up sliding back to the point of reconnecting with ourselves. So that is something that we really focus on here. And 2 questions on this slide. What sexual dysfunction side effects are the most difficult for you to live with? And are you aware that there are options for helping with sexual dysfunction issues? So often when we work with people, they know that there are prescription options available for help and that there are surgical options available for help, but they aren't aware that there's a whole middle ground in there that doesn't involve any of those things that you can do in the privacy of your own home. And one of those things that I keep mentioning is self-discovery. Self-discovery is a form of self-care and a way to reconnect with your body and mind, to learn and embrace the changes that your body has gone through, to kind of reclaim your intimacy needs. Self-discovery is masturbation. Masturbation can be done alone or with a partner. It is a perfectly healthy way, an encouraged way to awaken your body, kind of get things back online, to learn your new abilities, and to discover new ways of doing your old routines. Masturbation is the touching of one's genitals for pleasure in various ways. Masturbation is also proven to release endorphins, which cause feelings of physical and mental well-being, promotes better relaxation and sleep, enhances self-esteem and body image, reduces stress and relieves tension, and helps you to get to know your pleasure zones, your likes, your dislikes after your body changes, and deal with your intimacy issues. Masturbation also helps to learn new pleasure points around the body, to allow yourself to try new things, which might open some doors in regard to intimacy and sexuality in your life. A lot of times people get very discouraged when their old ways of finding pleasure don't necessarily work anymore because they've lost feeling in an area, because they've had nerve damage, because they've had things removed with surgical intervention. And they aren't aware that there are over 12 places on the body that are considered pleasure points or erogenous zones that have nothing to do with the genitals or the genital area. And so sometimes hearing that gives people a little bit of hope, especially if they've been struggling because they've lost function or lost their normal ways. But our bodies are pretty amazing and can do just about anything if you have the will. There's always a way. And then the side note at the bottom of this slide that I always like to touch on is masturbation does not cause blindness, make you dirty, have hairy palms, infertility, sexual perversion, religious deviation, or reduced sexual pleasure. Thank you. We are going to touch on some therapeutic devices that are designed for sexual dysfunction to kind of help get you back on track again if you are struggling to find your lost pleasure. What we're going to discuss is Kegel exercise therapy, dilator therapy, breast and chest massage therapy, erectile dysfunction therapy, and prostate massage therapy. And all the things that we have at Reclaiming, I think I've said this earlier, but we don't deal with medications, we don't deal with chemicals. Everything that we deal with is natural or medical grade. So there's nothing real dangerous, and it's all been doctor approved. The first is Kegel exercise therapy. So this is something that men and women can do, albeit slightly differently. Kegel exercise is done to help strengthen your pelvic floor. So your pelvic floor, if my hands are hip bones, just pretend with me now. Our pelvic floor is kind of a bowl, and the muscles fill our hips, that run up in front of our abdomen, that run up our lower back, and that run down our thighs, are all part of our pelvic floor. And so over time and over the years, our pelvic floors can become weak for various reasons. This can lead to things like incontinence of the bladder and bowel. It can lead to prolapsed organs for women. It can lead to pelvic pain, abdominal pain, back pain, all sorts of different things for both genders. Kegel exercise is done to help strengthen the pelvic floor. So for men and women who might not be sure what the pelvic floor muscles are, the best way to describe how you can kind of feel them yourself is when you head to the bathroom to urinate. When you start the flow of urine, and then you stop the flow of urine while you're still in action, and then you start it and you stop it, and you do that action repeatedly, those muscles that are starting and stopping the flow of urine are part of your pelvic floor. So if you're not sure what those muscles are, that's a good way that you can kind of tell and feel where they are on your own. For men to work their pelvic floor muscles, they do physical exercises and stretching. There's a variety of different exercises out there. And for women, they have devices that are specially made that can be inserted into the vagina, like the one shown on screen. And these are weighted devices. And we use those same muscles that we use to start and stop the flow of urine to hold these devices inside the vaginal canal. And doing this repeatedly, 3 to 5 times a week, using a lubrication every single time, that helps to build up the strength of our pelvic floor. Can help control incontinence. That can help to support our organs with strengthening those muscles, and can help with better sexual pleasure and function. There's lots of different types of devices that are out there for women to use to work on their pelvic floor muscles. Your best bet if you are struggling with incontinence or pelvic floor pain or sexual dysfunction is to find yourself a physical therapist who has been trained on the pelvic floor. There are more of them out there than you think. And for most insurances these days, pelvic or physical therapists do not even require roofs. Of course, you can always check in with your MD doctor if you're not sure about your plan, if you did need a referral. Physical therapists are fantastic to work with. They can help you narrow down the problems that you're having with your pelvic floor, and they can let you know the right types of exercise and devices that you might need to work through that. Because one note with Kegel therapy is that for some women, situations that they have, doing Kegel exercise can actually make those conditions worse. So if you are a female that is having pelvic floor issues, again, I highly suggest you check out a physical therapist in your area. They can kind of help to get you on track. But the good news is there's lots of different types of exercises, lots of different types of devices. You'll see a different type here in just a moment that can be used for Kegel exercise. The second is dilator therapy. Most often people have heard of this. We still have lots of different doctors and gynecologists that do prescribe different dilators to their patients when it is time and they need to kind of stretch those muscles and work things back out. Dilator therapy is used to help ease pain and discomfort in the vagina by stretching tissues and muscles and the vaginal walls. to help with pliability and natural function. Some women use dilators to also help ease the pain of gynecologic exams, and to kind of make any type of insertion, whether that be tampons or vibrators or anything like that, to just ease that generalized pain. Dilator therapy is done much like Kegel therapy. You use a lubrication with the dilators always, no matter what type of dilator you have, always use lubrication. And you insert it into the vaginal canal and you leave it in place. With dilators, you always start with the smallest dilator. And we always tell people that when you're being sized for dilators, and again, a physical therapist can help you with that. Your gynecologist can also help you with that. Should always start with the size of your own pinky. And that way, then you work up through the sizes. There's lots of sizes of dilators. And you then start with the size that is tight on you, and then you work up to larger sizes to wherever you're looking for to be comfortable with those exams or with insertions. And that's how dilators work. I mentioned there's lots of different types of dilators. If you are new with dilators, we always suggest that you look for some that either have a safety cord, like the Kegel exerciser did on this slide here, a long cord that you can hold onto, or that has the finger loops, like are pictured on these dilators here as well. And that's just for control and safety, because when we start doing something new, sometimes we are not always comfortable with what we're doing. So if we are in control and we have control of what's happening, that helps to ease our mental load to help us accept what we're doing and what we're working on with our bodies a little bit better. This slide shows two different examples of Kegel exercisers for women. I just wanted to show how the variety of shapes can be just very different. But all Kegel exercisers are weighted with different weights. And with the Kegel exercisers, you start with that lightest weight, and then you just keep working up through the weight sizes. However you pick for the shape to be, some people like the different textures, some people just like the smooth texture. It's totally up to the user. There are also some Kegel exercisers and dilators that vibrate. Why do these things vibrate? Because vibration helps calm our muscles. And so again, if you're new to dilator therapy or you're new to Kegel exercise, sometimes adding vibration can help those tense muscles relax a little bit to let you benefit more from the therapy. And then this one, this is for pelvic floor therapy, like I mentioned, and internal massage. So these types of devices are called wands, and these are used for internal vaginal canal and kind of cervical massage. So for women who are facing deep pelvic pain that are working with a physical therapist, they can often find different types of wands. Some of them are made to be frozen for cold therapy. Some are made to be warmed for heat therapy, which obviously is internal. And then some are just standard wands and some vibrate, just depends on kind of what you're looking for. But this can help to put gentle pressure in the area where there's pain inside from scar tissue, from surgeries, from cancer, from a variety of different things, and help to kind of ease that pain, which can then also help with vaginal function and restoring that muscle function as well. Breast and chest massage therapy. This has been around for about 6 years now. These devices are designed to be laid across the chest. They are kind of in what looks kind of like a bikini top shape, essentially, but they are pliable and movable. So you can have them across your chest to cover both breasts or where both breasts were, or you can put them on one side and move them up into the lymph nodes under the armpit. They fit into bras, sports bras, regular bras. They also just lay across the chest. These are used by men. These are used by women. Most often after surgery, after mastectomy, to remove cancer and remove chest tissue after the doctor signs off on it. We have people that wear these pretty regularly to help ease pain in the area, and it helps to kind of jostle those damaged nerves and really draws the blood back to the area to encourage healing. These are not, it's because it says low vibration. I always get a lot of questions like, does that mean it takes off and does things? No, this has very gentle, like a low, medium, high vibration. This also warms to the body. This is designed for comfort only. And so there's a couple different types of these on the market. Most of them look like the one that you see on your screen now. Some of them only have the one cup. So it really just depends on what you're looking for when you're out there or where you need the relief on your chest. But these things can be pretty magical for those people who need this type of pain relief. And many people just don't know that this exists because it's kind of newer. That's what that is. And we talked a lot about self-care and self-discovery for men and for women. And so often we get a lot of questions from people who either were raised to not discuss these topics, who have cultural or religious issues that prevent them from being comfortable with these topics. And so a lot of people aren't aware of some of the different devices, the very simple devices, small and simple, that can help you to connect with your own body and find pleasure with yourself. And these are different types of finger small vibrators that can ease muscle tension and that can provide pleasure around the body. Some can be worn on the finger, as you see, and others are just very small, like the Mighty Thick bullet is just a 2-inch long vibrating bullet. That's all it does. Not everything has a million bells and whistles. Not everything has 100 moving parts. Some things are for very basic, simple pleasure. And those are the things that if you're kind of new to all of this, is where we suggest people start. These are special devices for men. These are masturbation devices or masturbation sleeves, and these are two different types. And these are kind of the main types that you're going to start seeing out on the market. On one side, you have the Titan. This type is a one-handed use device that was designed for erectile dysfunction. The Titan and those like the Titan are designed to actually be able to ejaculate a flaccid penis. So many people always think that if a man does not have an erection, that they can't feel things or have pleasure the same way, and that's just not true. A flaccid penis has just as much feeling and the power to ejaculate as an erect penis does. And so these types of devices that are designed for that can be very beneficial to men who have been struggling for a while. On the other side, the Super Stroker kind of shows you the inside of what one of these devices looks like and all the little different textures and feels and all the different things that are happening in there when it's being used. These type, the penis is inserted, the suction builds, and all those textures help to provide pleasure. Always when you're using any type of masturbation device, you always want to use a lubrication. Helps to keep your tissues safe, and as you know, with chemotherapy and radiation, this can thin our tissues, our genital tissues especially, because they are already thin. So using a lubrication on any type of device that you're using on your genitals is a must, just to keep yourself safe. This is another masturbatory device for men. This one has heat and vibration, and that's a little bit different. This is more of a high-end one. We hear a lot from people that this specific model feels a lot like oral sex. So if you're wondering what these things feel like, that's what we hear a lot. And the next thing we're going to talk about is vacuum pump therapy. So this is going to be for erectile dysfunction. And we always like to cover this list of kind of like the pay attention list. So vacuum pump therapy helps men to strengthen the muscles and ability in their penile shaft and the muscles around in achieving and maintaining an erection. These pump systems are designed to help restore some or full function for males who are facing varying levels of erectile dysfunction. There's lots of different types of the pumps, which we're going to talk about in a second. But just so everybody's clear, a pump is not ever going to permanently fix the problem. A pump is going to provide you a temporary erection so that you can either have a penetrative sexual experience with your partner or an erection with yourself for self-discovery. these do not last forever. The girth and size increase that is given with a pump is not a permanent change. It can be a wonderful temporary change, though. Sometimes people think that these are going to cure all, and we always have to say that it's not a cure all, it's just kind of a helping crutch. With vacuum pump therapy, if you're using it like dilator therapy and Kegel exercise, where you're doing it 3 to 5 times a week, this can help restore that muscle memory and cell muscle memory in the penile shaft, which can help over time restore some of that lost function. So the list here in the middle, who should not use a vacuum pump system. And this does not mean that if you have one of these problems that you can't ever use a pump. This just simply means to check in with your doctor before you start using a pump so that everybody is on the same page and that we can make sure that you are safe. So those people who are on blood pressure medications, on blood thinners, those who have priapism, which is an uncontrolled, very, very long erection that you kind of have to go to the hospital to have help to have it go back down again. Sickle cell anemia, blood clotting disorders, or any type of heart disease or heart disorder. And then it's also extremely important as well that regardless of what type of pump you have, that you are only using the directions made for that specific pump. While pumps all kind of look the same and they have the same general idea of how they're built and work, there are small details on them that are just different enough that sometimes, if you're hop on the internet to find out how it works and you accidentally get the wrong directions, these types of things can cause issues. What are the issues most common from penis pumps? Penis pumps can cause what looks like deep hickeys on the penile shaft if the pressure gets too high. Now, of course, the user is controlling the pressure, but sometimes if we're using the wrong directions, we don't know if we're pumping too much. So that's why it's really important to use the right directions and to really pay attention to things. Now, are those hickeys on the penile shaft going to cause permanent problems? Absolutely not. They literally are just a drawing of blood that went a little bit too deep, much like a hickey you would get on your neck. They go away, but it can just be kind of frightening to look down and see, oh my gosh, there's a purple spot on the side of my penis shaft as I'm doing this. That can be very overwhelming. So we always like to cover all that as well. And the first pumps, these are all examples of different types of air pressure pumps. Air pressure pumps have been around for the longest time in the penis pump realm. And these are all, again, just various types. From the left side, this one is the most advanced. So this one is a one-handed use. Got emergency release valves. It's got the pressure pump. All of them have a see-through tube. And this is so the user can watch and see the girth and size change as they're pumping, so they know when to stop and what they're paying attention for. All of these pumps have emergency release valves, so if the pressure felt too high, they can easily just squeeze a little tip on the back and the air is released. How penis pumps work is they slide over the penis shaft and go all the way to the base of the belly. The user then pumps up the pump to their desired pressure till there are changes that they want to see happen occur. And then as they take the pump off, the black band that is around the bottom of these pumps, or another type of support ring, stays on the body at the base of the penis at the belly, and the pump is removed. That ring is what helps to hold the blood in place that's been pumped into the penis shaft, causing the erection, so that the person can use the erection for whatever they're going to use it for. And then when they're done, they can slide that ring off and the blood will flow back out. So that's how the pumps work. Lots of different pumps on the market. Again, it just depends on what you're looking for, what your situation is. And those are things that we help people kind of determine. And then another type of pump here, these are a little bit newer, the water pumps. So water pumps can be used in the shower or in the bedroom without water. So they're kind of a dual action. They use warm water and the warm water circulates through the pump with the penile shaft. Patients and people tell us that this feels very calming and relaxing while they are doing their different therapies, because many use these for their penis pump therapy. Water pumps are very size specific. So if you're shopping for water pumps, you're going to want to pay close attention to the boxes that tell you the sizes. So as you can see on the screen, the colossus is for penises that are 5 to 7 inches when erect, and the commander for penises that are 3 to 5 inches when erect. Those are very important details. If you are off in your sizing, the pump might not work as well for you. So this is why that matters. But again, lots of different types of water pumps out there for your choosing. Prostate massage therapy, this is probably one of the most taboo things that we discuss at Reclaiming Intimacy, just because of the area that it's in, what it involves, and just what it is in general, really. So prostate massage therapy is done to drain the built-up toxins in the prostate gland if the prostate is still present. If the prostate has been removed or prostatectomy has occurred for any reason, these types of probes are used for gentle pressure in the area where the prostate was to help ease pain, break up. Some men, in some cases, can also be a very good pleasure point because there's lots of nerves in that area that also lead to the nerves that can trigger erections and pleasure in the abdomen and groin. So prostate massage therapy is done by using teeny tiny probes. They look a little intimidating on screen, but they're all about 2 to 3 inches long. They're very small, and these are inserted into the anal canal about 1 inch to 2 inches, and pressure is applied to the P spot or where the prostate was, and that is how that therapy is done. This therapy is it's been around for hundreds of years, but it's most widely recognized with integrative urology specialists. So if you ever have questions about that, don't be shy to ask your doctor, but a lot of doctors will just kind of refer you to someone who specializes in this. Just for a heads up. And then there's a few other different products that I'm just going to touch on real quick because all of these still affect sexual dysfunction, and all of these can help you to get back on track to find that type of sexual interaction that you're looking for. So these are also designed for men, and these are for those men who have erectile dysfunction, either an occasional, partial, or a complete loss. These can be worn over the penis, whether it be erect at all or completely flaccid, and can help with penetrative intercourse. So there's the left side, you'll see, has kind of a strap at the base as well. We have some that are like this that are also designed to be put around the testicles to provide extra pleasure, because again, that tight squeeze can help to hold the blood in the shaft, thusly creating a more pleasurable experience. Or there's the type that's on the right side of the screen that kind of just looks like a base that slides over. This one has a belt that attaches to it that helps keep it in place, so that while you are having that penetrative action with your partner, everything stays where it should be. Both items are made of medical grade silicone, so they're actually very bendy and very soft, and they move and warm with the body. And there are lots and lots of these out there, many different types, some that even vibrate. So again, it just depends on what you're looking for in your situation. I discussed these support rings when we talked about the air pumps and how there is always a ring at the bottom of a penis pump that helps to keep that blood in the penile shaft. Those types of rings look like this left side of your screen, the retain. That's what a penis pump ring looks like. This is a universal replacement ring. So if you have pumps at home and you've had them for a while, you might need to replace the ring, and that is totally okay to do. There's lots of replacements out there. And then on the other side of the screen, the enhanced picture that looks kind of like small donuts, those are support rings. So those can be used alone. A man can use some lubrication. They can slide those over their penis when flaccid, and then they can stimulate themselves to create that erection with a support ring. Those are also very stretchy. They pull very far. They're very easy to get off, especially when using lubrication. And sometimes for some men who are facing a partial erectile dysfunction problem, these types of rings are all they need to provide that little bit of support to allow them to have penetrative sex acts. All right, I'm going to get into lubrications and daily moisturizers here real quick. A lot of people have lots of questions about water-based things and silicone-based things, so I like to touch on those as well. These are all examples of water-based lubrications. And as many of you know, you can get lubrications in like the tampon aisle of the grocery store, of all the Walmarts of the world and the Targets of the world. So you've got options everywhere. If you don't have easy access, check there first. Water-based lubrications are a thin friction barrier. Water-based lubrications do not last long because they're made of water and our bodies love water. So we just drink that stuff right up, just sucks right into our skin. You want to stay away from lubrications that have added extras like cooling, warming, if they have added colors, glitter, flavors, all of those types of things means that they have added extra chemicals, extra additives, and extra things that can be irritating to the skin. So just something to think about when you're using things like this on your genitals because it gets sucked right into our bodies to try to keep it as natural as possible. And that does not necessarily mean using foods for lubrication. So all your different olive oils and your coconut oils, all of those things have been linked to an increase of yeast infections. So just note to self that using products that are designed for this purpose is often best. And there are so many natural lubrications out there now that do not have additives, that are made of things like aloe and seaweed and skin softeners that are natural in our world, can be really amazing for your body too. And then we've got the silicone and silicone hybrid lubrication. So these lubrications are thicker. These are longer lasting. They do not suck into our skin like the water-based lubrications. So if you have sensitive skin, and these are the lubrications we always gear our cancer patients towards because the genital skin is so thin. These provide that thicker barrier, gives you more protection so you don't get friction burns or rubbing or anything like that that's going to cause any type of tearing. And these are also compatible with all of the different devices that are designed for sexual dysfunction therapies. So that's kind of the difference in the water-based and silicone, depending on if you need that thin friction barrier or that thick friction barrier. Daily moisturizers for women. A lot of times, women will route immediately to prescription types of moisture creams that have hormones in them, that have all the added extras in them to kind of get them going. And sometimes those work just fine. For some people, that's all they need. But for other people, that can cause a whole host of other issues. So using a more natural daily moisturizer to kind of get the body back on track sometimes can be really beneficial. So this is an example of one of those natural daily moisturizers that can also double as a lube. So using this every day kind of helps to awaken and restore those super dry tissues of the vagina without all the additives, without the extra hormones and all that jazz. And then the device cleaner. Again, there's device cleaner now right next to the lubrication in the tampon aisle of all the grocery stores. So you always have an option to clean your sexual devices, whether that be medical grade devices like I'm talking about today, or even vibrators and dildos and all the other sex toys that are out there. Sometimes using dish soap or just water does not get into those tiny little silicone pores that you can't see with your naked eye. There was a statistic that went around years ago that said over 80% of vaginal infections came from dirty parts, dirty hands, and dirty toys. And so that's something that we kind of always reiterate to make sure those devices are clean, sanitary, so that you don't end up with more issues while you're already dealing with so much. And then we also cover a whole line of breast prosthesis forms and nipples. I mentioned that insurance covers a lot of these different products, including the breast prosthetic forms. If you have a prescription from your doctor for a penis pump, for dilators, for Kegel exercisers, sometimes for lubrications, those can actually be covered. We do provide the L codes needed for those, and we do help people with their paperwork to file for their reimbursements. So if you have any questions about that, we can kind of guide and help there as well. And then on this slide, it just asks if anybody has questions about any of those therapies that we just discussed. Check the chat. I don't see anything in the chat. All right.
I think
Well,
we're
you guys
okay,
think
Jen. Thank you.
yep. And as we wrap up here, we always like to touch on this as well, because we found over the years that people aren't always told that they should be having safe sex while they're on chemotherapy and radiation. And the reason for that is because those two things have a detrimental effect on our cells and our DNA. And they can change our cells and our DNA in our bodies, which can cause damage to an unplanned fetus in pregnancy, or can even be upsetting to some partners. Some people can be very sensitive to chemotherapy and radiation particles, and that can actually cause issues for them. So, if you're participating in sex acts while you're on chemotherapy and radiation, some doctors say for 6 months after, some for a year after, to make sure that you are covering up any type of body fluid transmission. So using condoms, using dental dams, or even saran wrap to cover oral sex if you're doing things like that. Anywhere where bodily fluids are being shared just for protection, that's something that you should consider. And then we always ask the question if you were made aware of that as you began your cancer treatment, or if not, when you began, when you were informed. And then I mentioned about the insurance, and this is just again, just touching on that, but just like I just said, you need a prescription from your doctor. You need the receipt of your purchase for the item that matches that prescription, and then you can file for a reimbursement for many of these different products. We've had people on Medicare submit these things. We've had people from Aetna. Trying to think of the other big insurance, and I can't right now. I think it's past my bedtime. But yeah, so we can always help because the cost of cancer is astronomical. And so we like to help where we can to get people the things they need without costing them an arm and a leg. And so now we've kind of reached the end. So if you guys have questions, I'm looking in the chat right now. And yes, if you need more help from us, you can reach us through our website, or you'll get the slide presentation, and our emails are also in there, which we check all the time. We're happy to help guide people, to provide resources, to send you links and articles, whatever it is that you might need, we are here for. Again, that's just kind of our thing.
Yes, and I did include the Reclaiming Intimacy website into the chat. And for anyone, I will also include my email as well. If you would like a copy of the recording or slides, please let me know, and I can get them to you once I have them available.
I see another question just rolled in. Where are the other pleasure areas of our body? So that would be like another hour-and-a-half lesson. So I can't cover that all, but you've got your abdomen. I can't, yeah, because see now if I open this box, we're going to be here forever. You've got your abdomen. You have the backs of your thighs. You have your inner thighs, and all these have specific names, different erogenous zones. We actually have articles on our website that cover all of that. So if you're looking for specifics there that go into details, it's on there. And we also have a class that covers all of that as well. So we do lots of discussion about each of those different zones. You've got different parts of your back, abdomen, thighs, the backs of your calves, all over the place. And we discuss different types of sensory and sensual play. So like feathers, really soft, gentle things that you can do with those different areas of your body to kind of get that practice in. Because all those different pleasure zones require there to be a very, how do I say this, very minimal mental activity. So you have to be in a very good headspace, be connected with yourself to let your body and your mind go deeply into these pleasure zones. So these pleasure zones, they are there and they're wonderful, but they're not necessarily as easy to get started as the genitals, which is why there's a whole class on that too.
Thank you, Jen. If there are any more questions, feel free to put them into the chat and I can read them out loud. Or you can also unmute yourself and that'll indicate to me that you have a question. I can call on you. Jen, I'm going to stop the recording and see if we have any more questions. So I want to thank you so much. And let me just stop the recording really quickly.